All right, if you're a new nursing student, listen up because there's one tool you absolutely have to master. It's called the Braden Scale, and today we're going to break it down so it becomes your first line of defense. So let's just start with a number that's kind of hard to wrap your head around. $11 billion. Yep, with a B. That's the estimated cost every single year just to treat pressure injuries in the United States. It's staggering.
And, this isn't just about the money. Not at all. This is about our patients. It's about their safety, their comfort, and their ability to heal. So the big question is, how do we get ahead of this? How do we protect them from this danger that honestly is so often preventable? Well, let's dive in.
Here's our game plan. We're going to start with why this is such a big problem. Then we'll introduce our main tool, the Braden Scale itself. After that, we'll break down the 6 key risk factors it looks at, learn how to add up the final score, and then, this is the most important part, turn that score into a real plan of action.
Okay, first, let's really understand the stakes here. Pressure injuries, you might know them as bed sores, affect over 2.5 million people a year. And these aren't minor issues. We're talking about severe pain, dangerous infections, and a recovery process that gets completely sidetracked. But the key thing to remember is that so many of these are preventable if we just do the right assessment up front.
And that's where this tool comes in. Meet the hero of our story, the Braden Scale. And what's so cool about it is that it was created by nurses for nurses. Back in 1987, Barbara Braden and Nancy Bergstrom developed it, and today it is the most widely used tool in the country for systematically figuring out a patient's risk. So what is it really? Well, think of it like a detective's checklist. It's a standardized way to look at a patient's risk factors, so you could identify who's in danger before an injury ever happens. It's all about being proactive instead of reactive. Okay, if you only remember one thing from this whole explainer, make it this. Write it down. The lower the score, the higher the risk. I'll say it again, a low score means high risk. It might seem backwards at first, but as we go through the factors, you'll see that a lower score means more problems are present, putting your patient in more danger. All right, so the scale zooms in on 6 key areas. Think of them as 6 clues to your patient's overall risk. And here's a little trick to make this really stick. For each clue, we're going to imagine the ideal, low-risk patient. They get the highest score. Then we'll see how that score drops as risks start to show up. Clue number 1 is sensory perception. It's simple. Can your patient feel discomfort and then tell you about it? If you're sitting too long, you feel it and you shift your weight, right? A patient who can do that gets a perfect 4. But if their ability to feel that pressure or communicate pain goes down, so does their score, all the way to a 1 for someone who is completely unresponsive. Next up, clue 2, moisture. We all know that skin that stays wet gets weak and fragile. It breaks down. So a patient whose skin is typically dry scores a 4. But as that moisture exposure increases, maybe from sweat or incontinence, and you're having to change their linens more and more often, their score drops. A patient who is constantly moist is at the highest risk here, scoring a 1. Okay, let's talk about activity. This one is all about how much the patient is physically moving around. Our ideal score of 4 patient is up and walking the halls. But as their ability to walk goes down, from occasional walks to being stuck in a chair, and finally to being completely bedfast, their score drops at each stage. A bedfast patient gets a 1. Now, mobility sounds like activity, but it's different, and this is a key distinction. Activity is about walking around. Mobility is about the patient's ability to change and control their own body position while in a bed or chair. Can they shift their own weight? A patient with no limitations gets a 4, but someone who is completely immobile and can't adjust at all without help, they score a 1, and that's a huge red flag. Clue number 5 is nutrition, and this one is so important. Healthy skin needs good fuel, especially protein, to stay strong and heal. So a patient who eats great gets a 4. But if their intake is poor, if they're barely eating half their meals or worse, their NPO for an extended time, their score plummets. Poor nutrition makes skin incredibly vulnerable. And finally, our 6th clue, friction and shear. This just means the damage that happens when skin gets dragged against a surface, like when a patient slides down in bed. Now, pay attention here, because this category is scored a little differently. It only goes from 1 to 3. There's no 4. A patient who can lift themselves up completely when they move gets a 3 for no apparent problem. But someone who needs maximum help and slides every time, that's a huge problem, and they get a score of 1. Okay, so you've gone through all 6 clues. You have a number for each one. Now what? Well, this is where we put it all together and decode what it all means.
And it's really, really simple. Just 2 steps. First, you just add up all the points from the 6 categories. You'll end up with a number somewhere between 6 and 23. Second, you take that total score and you find where it lands on the risk chart. That's it.
And this table is basically your decoder ring. It turns that one number into a clear clinical picture. You can see a score of 19 to 23 is great, no real risk. But as that score drops, 15 to 18 is mild risk, 13 to 14, moderate, 10 to 12 is high risk. And if you get a score of 9 or less, that's a major red flag. That patient is at severe risk.
And this brings us to the most important part of all. A Braden score is not just a number you write down in a chart, it is a direct trigger for action. Your assessment becomes your action plan. The score literally tells you what to do next.
See, each risk level has its own playbook. For a patient at mild risk, you're focusing on the basics, turning them, checking their skin, getting them moving. But if they're at moderate risk, you step up your game. You're implementing a toileting schedule, maybe using moisture barrier creams. And for high or severe risk, you're pulling out all the stops. Special pressure redistribution mattresses, posting a turning schedule right there on the wall, getting nutrition and therapy involved. The score is your roadmap.
So look, the Braden Scale is an incredible evidence-based tool. It gives you a solid foundation, but it's meant to be used with your clinical judgment, your eyes, your hands, your intuition. That's your superpower. Use the scale to focus your attention, to start a conversation, and to build a plan of care that truly protects your patient from harm. The numbers are just the start of the story.